Tonight, the topic is obviously an important one, and it's Alzheimer's disease, and I call that graceful aging. So as you see, I found some pictures of really graceful people, and obviously that's what also aging can be. And there's so much worry right now about Alzheimer's, and everybody is either concerned about it for oneself or because of loved ones who suffer from it or might suffer from it. It's taking a terrible toll on our health and on caretakers especially. So the goal I have tonight, and that I hope to fulfill with you, is to give hope and also to demystify the disease, because I think part of the worry we have, or the fear, is like it seems like an unavoidable disease, a mysterious disease, and it attacks the brain, and then of course losing memory, our memory, which is the core of our personality, is a very scary prospect. So again, we're going to look at Alzheimer's from the point of view of Chinese medicine, Western medicine as well, and see how understanding the process of the disease can give us some answers as to what can be done to prevent that disease. Of course, probably there will be some questions about is it reversible, and we might touch on that toward the end if you have questions on that. But the bulk of my lecture will be on prevention and how to heal, early stages of Alzheimer's mostly. All right. So, well, let's just go into it. So, statistics are unavoidable when you start a topic like this. So right now there are several million Americans suffering from Alzheimer's, and it's considered to be the 6th leading cause of death.
Are you grouping dementia with Alzheimer's?
That's going to come.
Okay.
That's going to come. The prospect is not very cheerful. It seems like it's, according to the figures right now, it will increase. And currently there are about 18 million people worldwide with Alzheimer's disease, and the figure is projected to nearly double by 2025. So that means, a bit like diabetes, actually it's a worldwide epidemic. It's in Japan, in Korea, in Thailand, and it's all over the world. Nobody is escaping it. In terms of groups of people, I sometimes hear, maybe intellectuals suffer more from that, or, people have certain views of who is suffering more, and the truth is all groups are affected. Farmers, politicians, like I'm thinking, of course, of Reagan in this country, but recently a former French president was also diagnosed, Jacques Chirac, diagnosed with Alzheimer's as well. So it's really across the board. In that sense, it's a very democratic disease. So the common questions that I would like to address right away to get out of the way is, what is the difference between dementia and Alzheimer's? For the purpose of this lecture, it does not really matter very much. But let's say technically, Alzheimer's is a form of dementia. So that means it's actually 60% of the dementia. And the characteristics of Alzheimer's are a slow decline of memory, and changes of behavior, and the wandering off. These are some of the symptoms that define Alzheimer's. Dementia, on the other hand, can happen suddenly. Like, for example, there's what's called vascular dementia, which is something that happens right after a stroke. Or you can have a dementia associated, let's say, with after an accident, after a trauma. Or you can have, like, for example, Parkinson's disease can lead to dementia. So that means it does not start with a slow decline of memory. So, but really, it's the same type of characteristics. It's just they don't develop and don't happen quite the same way. Okay? Is Alzheimer's part of aging? Is it fatalistic and unavoidable, which is something I found in several Western reviews. So is it part of aging? Well, obviously no, meaning there are many people, thank God, who do not get Alzheimer's or dementia when they get old. And then a question that sometimes is asked is, well, is it because our society is aging? You know, we have more elder people, so maybe there's more Alzheimer's just because we have more elder people. But that's not true, because in each group, like let's say, for example, the 60 to 65 years old, each group, there is an increase. So it's not just the number of people, it's a proportion that's increasing and seems to be increasing more and more, right? Is it genetic? That's another thing that is often thought or asked, and the answer is no. Actually, even considering Western definitions, they consider that about 1% could be considered really genetic, and less than 5% has a tendency, you know, meaning that even in that 5% of people who might have a genetic predisposition, not everybody gets it. So there's about 1% that's considered strictly genetic. And by and large, it is not a genetic disease, all right? Is it irreversible? So I would like to, I'll come back to that later, but the question is open in terms of when you can act on the disease. Certainly the brain is very flexible. There's actually a term for that, which is neuroplasticity, which is until recently, scientists thought that the brain was declining and decaying with age. But in the last decade, it's been found that the brain is constantly creating new neurons. And that the name given to that is neuroplasticity, meaning the brain is constantly creating new pathways and new neurons. So that's extremely helpful and hopeful, meaning that as we age, and I remember for those of you who are into macrobiotic, that, you know, George Osawa used to say that we should have a better and better memory as we grow older, because we use it more and more. And actually, with modern research, that is validated, meaning if we don't suffer from a disease, our memory should not decline. Our brain is constantly creating new pathways, and the more we use it, and the more those pathways can develop. So that's very hopeful, right? So the characteristics of Alzheimer's are memory loss, what is called narcolepsy, meaning, you know, falling asleep suddenly in the middle of a sentence, or we're not just talking about dozing off after a heavy meal, you know, but loss of language skills, changes in behavior, and in particular, a certain aggressivity, which is why it's so hard for caretakers very often. There's often, you know, some anger or some aggressivity that comes out. There can be also a loss of sense of time and day and disorientation. Now, one thing I'd like to say before we keep on going is that in the research that some of which I'm going to share with you of Western medicine, I think it's really wonderful, the kind of exquisite detail that science is coming up with in terms of the functioning of the brain cells and, you know, the processes of the brain cells is just really amazing. And the problem, though, is that it's like very often when I would read some of the books for this project, it was so exciting to find, like, you know, about neuroplasticity and, you know, all this incredible research. But then I always end up disappointed at the end, because it's like when you come to conclusions, it's like, okay, what conclusions can we draw from that. It's like that's where most Western scientists become, I would say, almost paralyzed because they cannot say anything that's too simple. You know, so if they come, let's say, and we're going to share some of that, a relationship between food, obviously, and the disease, it's like they say, well, that might be helpful, even though, you know, all along you find really a lot of evidence. But, you know, there's that tendency in our modern society today, and the scientific community in particular, you cannot be too simple. It just won't do. You know, you have to come up. So they're great as long as it's complex and the details. But when it comes to conclusion, it's like, okay, well, we need more research, we need more studies, and we need to find a medication. You know, that's always the conclusion. So you will see, actually, I hope you know, to show you what I mean by that, because all along the research for this, that's what I found constantly is the, you know, the gap between the research and then, well, isn't that an obvious conclusion? But they don't want to go there because it's too simple. All right. So on the side of hope for memory, one study that was done that is very interesting was 3 groups of people. They wanted to see how are we affected by the beliefs we carry about memory and aging. So they chose 3 groups, and I'm not quite sure on what basis for each one of them, but one was Chinese people, a group of Chinese people, because China has great reverence for elder people. You know, and actually I lived in Japan for 6 years, and I know I met personally several people who told me how excited they were to get older, you know, because they were going to get the respect from the younger generation. And it certainly is the same thing in China. Their great reverence. I know I was surprised, for example, to see that they were hiring teachers until 75 to 80 years old. You know, I mean, if you were able to, you could find a job teaching. So they chose Chinese people for the reverence that they have for older people. And then they chose a group of deaf Americans. And that's interesting because deaf people apparently also do not share, maybe because they're more visual in there, I'm not quite sure, but they don't share many of the beliefs about old age and memory. So that was the second group. And the third group was a group of regular Americans. And so they gave them all kinds of problems. Let me go back. All kinds of problems to solve linked to memory. And they came up with the fact that the belief system was extremely important in the way people performed. And Chinese people in particular were able to perform just as well as the younger people. So that was one of the studies cited as showing that our belief system plays a tremendous part in what happens also. So of course I think that right now, and that's what I hope to do a little bit here, is to dispel that sense of doom. Like, because if we carry that, you know, when we are terrorized at the thought of getting older because it might happen, that's part of a belief system too. So we need certainly to get as informed as we can on the hopeful side, all right? So another study showed that the focus on past events, which is something that happens a lot in old age, and sometimes we worry about that, you know, like it might be a sign of Alzheimer's. People seem to recall more, you know, the past, far away past, but have less memory of more recent events. And basically, what they found in terms of research on the brain is that it's no more work for the brain to recall recent events than it is to recall faraway events. So basically what that showed was that the reason why people lose memory of recent events as they get older is simply a loss of interest. You know, meaning that very often we associate our best times with, you know, being younger and handsome and, you know, pretty and all of that. So that there tends to be a focus on youth and events from the youth, and not very much attention, you know, which can be part of some depression, not much attention to more recent events. But when the interest is there, when there is the same enthusiasm to the recent past, then the memory of past, of, you know, a recall of recent memory is just as good. Okay. And the third one, on certain of hope, was what I mentioned before about neuroplasticity. So, you know, we often are told, and scientifically, that we only use about 10% of our brain. So imagine 10%, that's really little, right? So there's 90% to discover. So that's what the latest research seems to go in that direction, where that actually the brain, if it's stimulated enough, keeps creating new pathways. That's hopeful too, right? So let's look, before we go look at the disease, at what a healthy brain is. What does it look like? So here is one. So as you see, it looks a little bit like a walnut, kind of, right? And that's funny too, because walnuts in the pharmacopoeia of Chinese medicine are considered to be a food for the brain. And so in Chinese medicine school, many of my schoolmates would just bring, you know, bags of walnuts and eat them before exams, you know. However, I don't know about raw nuts is more a problem as opposed to cooked nuts. But anyway, you can see the relationship, you know, the theory of signatures. So walnut is considered a brain food in Chinese medicine, right? But cooked, right, raw. So it's soft. It's a bit like a sponge, right? And it's very full, very dense. And if the brain is healthy, you know, we have a bit, there are different parts of the brain. The back is a little bit more related to the past. I forget my tech tools here. Present, and more future is more the front of the brain. Here are some more pictures of the brain. I love this one. It kind of looks like a frog, doesn't it? And I don't know if frogs are a good brain food. And the different parts of the brain. And what I'd like you to notice is especially this part. We'll come back to that in a moment. This part, which is called the hippocampus, because lots of the first signs of Alzheimer's come in that area of the brain. And here it is, the hippocampus. I don't know if you would say hippocampus or hippocampus. Yeah, hippocampus. So it's called hippocampus, which here means horse, because it looks like a seahorse, you see? And it's right in the middle of the brain, and that's where the first plaques, the first disorders happen in Alzheimer's. Some more of the brain. So the back is called the cerebellum, and then this is the cerebral cortex, the envelope, and as Alzheimer's progresses, it tends to reach more the periphery and the outside of the brain. And I'd like to bring attention to a little gland that we have inside the brain, which is the pineal gland, which sometimes is called the gland of light, and plays a big part in occult studies, you know, in terms of developing the pineal gland and the third eye. But here, what interests me more here is that the pineal gland is very prone to calcification as we get older, meaning it gets calcified, it gets hard, meaning it gets little stones, just like the gallbladder or the kidneys. Interesting, isn't it? And the brain functions here, there are many theories about various aspects of the brain, so I don't want to go there. That's a rather traditional model. But basically, you can see that the part around the hippocampus has to do with memory. So this is the part that's usually affected first. Okay? All right, so let's go now to the side of Chinese medicine. The brain in Chinese medicine is called the sea of marrow. All right? And it's very interesting. The word itself is interesting, right? Sea of marrow. So that means that in the Chinese medicine concept, there is that image of the importance of fluids. You could say fat also, but it's the brain and the spine. You know, it's the marrow is what fills the bone, the spine, and the brain. It's a bit different from the concept of bone marrow in Western medicine. So it's that fluid type that is, you know, as we saw in the softness of the brain. And it's seen to be very connected to the kidneys, right? So one way of looking at it would be like the kidneys would be the water, the ocean of our body, the reserve of water. And so a lot of that goes up to the spine and to the brain and fills the spine and the brain. So that means that in the Chinese medicine concept, the health of the brain is very dependent on the health of the kidney. Right? We talked about kidney essence, the essence of the kidneys as nourishing the brain. So for example, a child who is born with autism, in Chinese medicine, part of the diagnosis would be deficiency of kidney essence. Okay? So you could say with the name sea of marrow, a concept that the brain is very dependent on the yin of the body, right? The yin part of the body. But at the same time, it needs the yang of the body, yin and yang. It's familiar to most of you, right? It needs also the strength to go up and fill the brain. So there's a need, the substance that the brain gets nourished from is very yin, but it also needs this upward movement, which is more yang. Yeah? So and right now I would like to kind of put a few things together, and then we'll get to some conclusions from that. Let's look at what a healthy brain needs. And here it does not take very much to know, which is a healthy brain needs, first of all, blood, right? Sea of marrow, so it's very dependent on the liquids, on the fluids of the body. So it's very related, therefore, to the heart, because the heart governs blood. Here, that's Chinese medicine. And also to the digestive system, because, of course, the quality of our blood comes from our digestive system. Yes? Following? The other thing that a healthy brain needs is glucose, right, for good energy. So that means spleen, stomach play a big part in the we would say Western. This is a bit mixing Chinese and Western medicine. In Chinese medicine, spleen and stomach are the center of the sweet taste, right? So glucose, in Western terms, we would say more insulin and pancreas, right? Very strong connection. So there needs to be good nutrition coming to the brain. And finally, it needs oxygen, which, of course, our lungs and sinuses play a big part for that. Our respiration plays a big part. And then it also needs good fat and water. Yes? Following so far? So in Chinese medicine terms, what the brain needs is good body fluids, including the blood, a good quality of body fluids, good substances, good blood. It also needs more yang. So the way we look at that in the Chinese medicine model is the functions of the brain, the functioning of the brain is a very subtle activity. So you could say it's pure yang. You know, like we say that the fact that our eyes can see, that our nose can smell, that our ears can hear, this is pure yang. This is a very subtle function. Right? But all these very pure yang functions are very much dependent on the quality of the substances in the body. The yin, the body fluids, the water, the metabolism of making substances. And that's all I'm going to go into there right now. All right. So memory in Chinese medicine is actually related to three main systems. And that's a very interesting concept, I think. There are three types of memory in the Chinese medicine model. One related to the heart, to the functions of the heart. But again, the Chinese medicine concept of heart. And so the heart would be related to our consciousness, being able to have, our talents, our personality being radiant, being the kind of radiance we have in the world, our total consciousness. That's the shen, that's the heart. And so the memory of the heart is what makes us be ourselves every day. The total of our personality, our ability to function, our ability to decide, to choose, everything that has to do with everyday life and being ourselves. That's heart. The second one is memory that is related to the spleen. And the memory that's related to the spleen has to do more with digestion. So digestion of foods, but also digestion of facts. So that's the learning that we do, how we study and remember. So students, and there are a few here tonight, they need to have good spleen memory, meaning that's the intellect, the ability to study and then make it our own, making our own wisdom. Just like when we digest food, it becomes our own flesh, right? So that's the memory associated with the spleen, is our apprenticeship and our ability to learn facts. And then finally, there is the memory of the kidney, which is more the deep memory. You could say instinct is part of it. DNA would be part of it. We can say we have, of course, a genetic memory in the color of our eyes, in the color of our hair. That's a deep kidney memory. So you could say generational, cultural memory, instinctual memory has to do with kidney memory. Okay? And when I say heart, spleen, and kidney, I'm not going to go into that, obviously, tonight, but that's more than just the organ. It's more of a system. So let's look now what happens with a diseased brain. These are pictures of different, that's a healthy brain, mild Alzheimer's, so you can see how it gets a bit shrunk. And what happens is basically the connections, the microtubules, how do you say that, microtubules, get broken, and so it creates kind of a mess, of broken mess, which is what is called the amyloid plaques. So when you go to a doctor's to be evaluated about Alzheimer's, that's what they look for, the plaques in the brain. And so the neurons get diseased, and you see how they get brittle. And so already you could see and how everything shrinks. Like here is severe Alzheimer's. Let me give you a few other picture. So, but what you can see already in that shrinking is that the yin, the substance, there's a drying, there's a calcification of the brain. And there's actually what is called brain sand and calcification. So it's interesting, isn't it? Calcification means too much calcium in the blood, right? That forms plaques. So there is actually calcification. So you can see in that sense that already the disease is not different from what happens to calcification of arteries in heart disease and other diseases. So here are several other views of a diseased brain. So here, this one is very clear. Sometimes the brain can be reduced like to by 3/4 of its volume. That's how much it can shrink. And you can see how it gets here darker, also in color, and how it gets, how it changes, and you see how there's more space. So there's definitely a shrinking of the matter of the brain and calcification. So let's look at what Chinese medicine can tell us about what is happening. Like I mentioned, the sea of marrow, right? You can see how the sea of marrow is drying and shrinking. So in terms of Chinese medicine, there's a kind of yin deficiency, what we call a yin deficiency, a drying out that is happening. And very interesting, actually. In Western medicine, people who care about, take care of people with Alzheimer's, often report that the symptoms get worse at night, okay, in the evening, so that people tend to get very agitated. It might be the time when people with Alzheimer's tend to wander off. And so there is a name for that. It's called sundowning. And that's the medical term for that, is that worsening of symptoms in the evening. So what is interesting about that is that in Chinese medicine, what we call yin deficiency symptoms are also symptoms that tend to get worse in the evening. So for example, if you have lung problems, let's say, and you go see a Chinese medicine practitioner, and you explain that your cough gets worse at night, okay, right away we think, okay, that's a yin deficiency sign. So symptoms like night sweats tend to be yin deficiency signs. So it's that kind of heat, which can be emotional heat, that tends to happen more in the evening. And interestingly enough, also in Chinese medicine, the kidney time, the time when an organ or system is both recharged and can also be more fragile, is between 5 and 7 p.m. This is kidney time. So I was actually thinking about that. Think about happy hour, right? That's kidney time, meaning the time when the adrenals, in Western terms, get weak. So, and people do get agitated. You know, people out there, of course, we're not talking about anybody here, but how that's a time when agitation starts. And also where usually there's a craving for sugar. And of course, alcohol is a form of sugar. So that craving for alcohol in the evening is a type of yin deficiency. And yeah, that's all I wanted to say about that for now. So one of the recommendations, actually, for people who take care of Alzheimer patients is to try to get them, to feed them early, like around 5 o'clock, to avoid that the glucose, the blood sugar drop, and that agitation. So that means if you take care of someone who is severely ill and gets that agitation, one of the ways is, of course, to make sure that around that time it's especially quiet, meaning it's a bad time to have the news with bad news on TV. It's some soft music can be helpful. Make sure that they eat early enough so that their blood sugar stays even is one of the recommendations. So obviously the brain needs, we talked about that, the brain needs to be well fed in terms of blood. So one of the main causes, 60% more risk of Alzheimer's is linked to heart and cardiovascular diseases, hypertension, and including actually bypass surgery. We tend sometimes to minimize, it's becoming so common to have bypass surgery. Nothing is without risk. And many people experience a decline in cognitive functions after a bypass surgery. And so that can lead to some depression, which then also increases the risk of Alzheimer's. Strokes, I told you about the vascular dementia. That's the name given to people who experience loss of cognitive functions or decline of cognitive functions after a stroke. And that's also a very common scenario. Hypertension doubles the risk of dementia as well. So when we look at that, again, it's kind of simple in a way, is that, well, common sense means that everything we're going to do for the health of the heart is good to do to avoid Alzheimer's, right? The two are so related. It's a no-brainer, right? So we know enough, certainly nowadays, we have enough information about taking care of the heart to know what the high risks are, meaning that low fat, no hydrogenated fat, so meat, lard, butter, hydrogenated oils are all in the risk factors of heart disease and therefore of Alzheimer's. Dairy is also a big one in terms of the fat, right? And then so basically what we can already see is that the vegetable-based diet based on grain, legumes, fruit should be the main diet, obviously, to avoid heart disease as well as to avoid Alzheimer's. Good rest, manage stress, that's also what increases the risk of heart diseases. Okay? So that is an obvious connection between the two. Another thing, I want to talk about is the brain-gut connection. Now we talk about in several scientific reviews, and they talk about the second brain as the gut. And you might actually have been learning in school that there are two nervous systems, the sympathetic and parasympathetic nervous system. But actually, it should be three. It should be sympathetic, parasympathetic, and the enteric nervous system. And what enteric means is the nervous system of the gut. Right? Because what has been found, and actually it's not that recent, it's apparently research that had been done over 100 years ago and just recently was rediscovered, but is that there is a very sophisticated nervous system in our gut. And that nervous system, there are millions of cells and neurons in the gut, and that nervous system is pretty independent, meaning that there is a vagus nerve that links the brain and the gut, but even if that is cut, the abdomen keeps doing its work, the gut keeps doing its job. So that's why they call that the second brain. And you can see this was a funny picture drawing that I found, but there is definitely kind of a connection between the gut and the brain in the look, right? In the structure. For example, Michael Gershon, who is an MD, wrote a book called The Second Brain. And his book is really fantastic in terms of, the amazing work that is done in the gut, and fantastic in terms of research. But that's what a little bit like what I was telling you before. The conclusions at the end were like, okay, so what? At the end of the book. But one of the things we were talking about yin deficiency. One of the things that he talks about is that at the beginning of the digestive process, there's about 9 liters of liquid that comes into the intestine. So 9 liters is, let's see, a little bit over 2 gallons of water. Right? At the end, there's only about a tablespoon of water that should come, with the bowel movement. So what that means is that, the gut is not just a pipe where everything goes through. There's a lot that happens, and in particular, the absorption of nutrients and the absorption of liquids. So remember, we were talking about yin deficiency. So the gut does play a big part in that, also that absorption of liquid. So in terms of the process of the disease, what that tells us also is that a lot of the neurotransmitters, a lot of the chemicals that are found in the brain are also found in the gut. So for example, dopamine, which sometimes, or serotonin that we call the feel-good chemical, the dopamine also, these are found actually more in the gut than they are found in the brain. Like, I think it's melatonin. There's only 2% in the brain and 95% in the gut. Right? So what insulin is found in, of course, in the digestive system, in the pancreas, but also in the brain. So that's one of the things that has come out in the research in the last decades or so, is that a lot of those chemicals in the brain are also in the gut. And another thing that was found in various studies about Alzheimer's is that there is a strong correlation between abdominal fat and Alzheimer's. So, of course, obesity and being overweight, excess fat, plays a part in all diseases, heart disease and so on. So that correlation was well known. But the fact that there is more of a correlation between abdominal fat and Alzheimer's, that it increases the risk. So basically, again, common sense, is if we want to reduce the risks of Alzheimer's, is to reduce abdominal fat and increase our brain volume, right? That is, again, a no-brainer. What's that? Right. So in terms of very simple things that we can do, in order to take care of our gut and our brain, is obviously to have foods that take care of our intestinal tract. So what that means is high fiber food, to avoid. And the easy thing, is like when we think, whether it's heart disease, diabetes, whatever, we always come down to the same thing. We might, there might be some difference about certain details, but basically, we always come down to the same culprits and the same good things. It's not that difficult. So when you talk high fiber food, what are you talking about? Whole grains, beans, vegetables. And when we talk about no fiber foods, which one are we talking about? Processed foods, baked goods. Especially, I should say, white flour and so on, yes. Meat. Ice cream. dairy, these are the no-fiber foods. So obviously, we know what to increase and what to avoid, right? And some of the very good foods for intestinal health are especially fermented foods, the one that are natural probiotics, right? We talk about probiotics a lot these days, and it can be pretty expensive. But in our food, we can certainly introduce them with fermented food. So I put down a very old one, miso, which is made in Japan and is a long process of fermentation. And Japanese people, are as proud of their miso as maybe French people are proud of their wines. They have different types of miso, and depending on the aging and the length of time, you can find very high quality miso. So it's a good investment, definitely, to get a good quality miso, not one that is, rushed into fermentation. So, and we certainly are lucky enough here in Asheville that we have a couple of places, that make miso, like, what is it called, Master? Miso Master is right here in Asheville. There's also Natural Import that imports, miso from Japan, is right here in Asheville. So, and it's all present right here. Sauerkraut, obviously, is another one. Shoyu, fermented, cultured vegetables, all of these are great sources of probiotics. So that means taking care of our gut, making sure that we have high fiber foods is the best way to ensure that the chemicals that also feed our brain are there too.
What was the third thing you mentioned? Soy.
Shoyu, which is a name for soy sauce, right? Tamari or shoyu. Okay. Okay, so next is, let's look, since we talked about the guts, at the pathway of our gut. And basically, we have kind of a hole from, the mouth to the anus. It's one long empty space, right, with lots of activity, and starts with the nose and the mouth and go all the way down to the anus, right? So I want to talk about that. I want to develop a little bit later, but the reason why I want to show it right now is obviously it makes sense also that anything that is toxic in that area, of course, the toxicity doesn't remain there. It can go up, like when we have bad breath, for example, after, if our liver is sick, we have bad breath. Obviously, the toxicity does go up. It does not, just remain in the bottom part. And this is, a very free highway, kind of, where everything circulates. So we already talked about the common sense, intestinal health, food high in fiber. We're talking mostly about the plant world. No fiber foods, the meat, the dairy, the sugar, and refined foods. And a toxin-free transit, meaning avoiding foods that tend to decay and create toxicity in the intestinal tract. Okay? Let's go a little bit on the side of Chinese medicine here, because it can be helpful too. The large intestine meridian, which you see here, there's a branch that goes inside, and it starts here on the index finger, goes up, and it ends up here at the side of the nose. Okay, and there's an inner branch that goes to the intestine. So in acupuncture, very often with problems of the face or sometimes sinus problems, we are going to do a point that's called large intestine 4 that is right between the index and the thumb. laxatives. So he was talking about like very strong herbs, you know, like senna or cascada. What do you call that? Cascada. Right. So those two are very strong. So that means that those herbs, you know, should be very occasional for, you know, to promote air and oxygen. So we need good qi, we need good oxygen to feed our brain, right? And so there is a very strong correlation between our lungs, between our digestive system, and also between our nose and sinuses. Right? Obviously, in order to breathe correctly, we need to have a good nose, a good open nose that can, you know, take in the air and take in the oxygen. So I want to talk a little bit about sinuses and the importance of the sinuses and sinus health. And the sinuses are kind of a junction between the stomach and the, you know, that tract that we saw, intestinal and digestive tract, and the lung and the oxygenation, right? The way we breathe. So here we see how the sinuses can get very sick, can get, you know, there can be actually polyps in the sinuses. It can harden, it can also calcify. And in a Chinese medicine, sinuses or the nose or the throat, they are part of our lung system. The nose is actually the opening of the lung. And obviously, again, no-brainer, is like, obviously we do need to have good inhalation, good respiration if we want to have good breathing function, and therefore good oxygen supply to our brain. Yes? So some of the signs, you know, that come with sinus problems can be facial pain, nasal obstruction, nasal discharge, diminished sense of smell, cough, bad breath, and dental pain. These can be all signs associated with sinuses. So why am I going into that? Is that in Western medicine, again, they take the loss of smell as one of the possible signs, warning signs of Alzheimer's. And they've even designed what is called the sniff test, you know, where they give like 10 odors to smell, strawberry, banana, I don't remember what else they give. And it's not, you know, 100%, meaning there can be other reasons, but that is one of the warning signs that there can be Alzheimer's. So last year I did write a newsletter on that, and I always tell people who come to my office, you know, really take care of your sinuses. It's very, very important. Because as we could see before, if there is toxicity, if there is pus, if there is infection, that is right near the brain, and there's direct intake into the brain. So, and there was a study also done that showed that a great proportion of people with Alzheimer's had been plagued with severe sinus problems during the 7 years that preceded the onset of the disease. So that means strong correlation there. So obviously, again, at least the good news about that is that one of the things that we can do to avoid Alzheimer's is not to minimize, you know, the chronic sinus problems, and really take good care of our sinuses. Any question on that? Yeah?
What do you think of using salt water or neti pot?
Okay, I'm coming to that. Coming to that right away. So common sense, what does it mean? Again, the good news is we we always come down to some of the same thing. So we want to avoid mucus-forming foods and habits. So avoiding dairy, sugar, uncooked nuts. And this I want to mention because I've seen actually some vegetarian people with sometimes very severe sinus problems. And usually the problem is that they overdo the nuts and the nut butters. They think, oh, we need protein. We're vegetarian, we need protein. So they go to the nuts and nut butters, and they can really get very clogged. Some of the, in particular, the gallbladder, and when the gallbladder is taxed, it can create, cholesterol, it can create mucus, and that tends to accumulate also in the sinuses. So flour products, gluten, of course, especially when people have gluten intolerance or celiac disease, and allergens. And that, I would say, nowadays we all need to be alert to what constitute allergies for us. Especially if we have if there are digestive problems. I mean, it's amazing. I'm very amazed sometimes by what people can be allergic to or what they find out. I often work with people keeping a diary of their foods for a little while and to connect certain symptoms. And sometimes it's like, it's amazing what can come up. Like recently there was a lady where obviously the correlation was between buckwheat and her symptoms. I would never have imagined that. So, it's like nowadays, especially if you have, your system and you have a weak digestive system, you kind of need to be alert and discern what constitutes an allergen for you. And everything that promotes good digestion will be helpful. So that means we need also to pay attention to the food combinations, not just the foods. So a common mistake that we all tend to make even when we take care of our foods and health would be, for example, to eat grain and sugar together. Would not be a good combination. Anything that creates mucus. So how can you tell? Well, you can observe. If you feel stuffed up, or if after certain foods or after certain meals, you can certainly observe what was the cause. And things like overeating, things like the way we eat, like so good chewing, relaxed eating, all of that, of course, plays a part into avoiding the creation of mucus. Things like deep breathing, yoga, qigong, any type of exercise, anything that helps the oxygenation of our brain will be also helpful. And finally, aromatherapy is, of course, very helpful. Here we have somebody who works a lot, Tacy, who works a lot with aromatherapy, and definitely using peppermint essential oil, to help clear the nose can be also very helpful. So basically taking good care of our breathing apparatus. Yes, you had a question?
Just a quick question. A lot of people soak their nuts.
Yes.
And sprout them a little bit.
Yes.
Would that help, or is that still not so?
That would help, yes. Mm-hmm. Yes, absolutely. Yeah. The question was, she said, because I mentioned that uncooked nuts, raw nuts, and she said, well, some people soak their nuts and sprout them. Would that help? And yes. It's a form of cooking, right? It's not cooking with heat, but it's still a form of cooking. Yeah. So another thing that's very helpful is the neti pot. And here I made a copy of something I brought back from France, where nasal health is pretty popular right now. So there's a book that says La santé par le nez, health through your nose. And I actually bought several of those things, and I have a few if anybody is interested in that. But where you know, you use little stillets like that, and you put them in your nose. So you do the neti pot, and afterward you stick that in your nose, and once you get used to that, it actually goes to your throat, and it kind of gives a gag reflex. And so I'll tell you, it really definitely clears up your nose, right? And what the lady who wrote the book says, she did a lot of research in that. In Ayurveda, of course, it's an old, you know, it's very well known, that technique. And even in China, they used to have little bamboo things that they would put in the nose to tickle the nose until it creates a sneeze, right? And so it's the same technique, is to get, so when you have that gag moment, first of all, it clears up a lot of the nose, and also it makes the mucus from the upper lung come up, right? So there's another one that I used to do a few years ago. I have not quite gotten back into it yet. I'm working into it slowly, but where you put, you know, a little, I don't know how to describe it, kind of, it's not plastic, but a kind of a little cord, and you put it in your nose, and it comes through your mouth, and then you kind of... Right. It's, yeah, actually that's a good word for it. It's a nasal floss, kind of. And I used to do that several years ago, and I don't know, I lost the habit, and I moved, and I had lost the cord, but I got some more. And so I think I'm ready to take that. Partly, you know, you know how we get into something and we forget. It's like all the studies I saw. The sinus stuff is so important. I thought, whoa, I'm going to take care of my sinuses too. So that's why I ordered some of these again, which I used to use, and I've gotten back into it. And really, once you get used to it, like it's been now a couple of months since I've been doing it again, and it's a bit like, brushing your teeth. Actually, I miss it when I don't, because it gives you a clarity. And I'm amazed too, very often I'm not aware that my sinuses are clogged until I do that, so. And certainly, again, with all the research there is it's well worth, making sure that our sinuses are healthy.
What kind of salt do you use?
The flower of salt. Flower of salt, a very soft salt, the top, because it's the softest. And also a recommendation that I got from this too is to put a little bit of magnesium chloride in it, just with the salt, which makes it so that if you have any irritation, it's softer, it's less abrasive. So that's one thing. But definitely you don't want, salt that's too thick, or certainly not sodium. It has to be a very good quality of salt. And the flower of salt is a little bit more expensive, but it's very gentle and soft.
Magnesium, what?
Chloride, magnesium chloride. So, and it's a practice that goes back thousands of years, and you find it everywhere, in India, in China, in Egypt, and the pharaohs, were using that. It's a very old technique. So here are some pictures, actually, of that, how to use those. And also, another very good thing is any self-massage, of the nose. Facial, we'll do a little bit of that to give a break at the end, but facial massage and the points, for to clear up. So working on the stomach meridian, working on the gallbladder meridian, all those meridians have points on the face. And one thing that's also very helpful is facial massage. And again, you could talk to Tacy at the end if you want. She does quite a bit of that. One thing I discovered, at some point I was doing a lot of facial treatments, with acupuncture, and also using a machine called an Accutron, doing some stimulation. And I did not think of that, but from people who received those treatments, I slowly developed the term in my advertising of that was the side benefits as opposed to the side effects. Like, people would say, oh, it's funny, I had a couple of facials and the pain in my back really got better. Or, of course, sinuses was a big thing. They would say, my sinuses are so much better. Because, when you do a facial massage, you have steam, and I was using essential oils in the steam. And, all those points, of course, they have connections to the stomach, and there are bladder points, so they can be very helpful for lower back, too. Yes?
Casey is the best person this side of Tokyo for that. I go regularly. She is fantastic.
I have no doubt. And she's, All right, so facial massage and aromatherapy are great tools, okay? So there are many things you can do, like, the steam, of course, and with the oils. Like, that's something I do also in my practice, is to use a steam with essential oils when I treat people with, sinus problems. Okay? So anyway, I hope you get the message. Sinuses are a big part. And I want to emphasize that because we hear all the time, oh, I'm healthy, except for my sinuses. Right? Well, sinuses means breathing, right? So it's very important. And again, the research on Alzheimer's really emphasizes the connection there. And we're going to talk about one more aspect, which is in the modern research about Alzheimer's, the wording that you find more and more is diabetes of the brain, the third diabetes. And first of all, diabetes is one very important risk in terms of Alzheimer's. People with diabetes have twice the risk of Alzheimer's. I told you before, insulin is not just in the pancreas, it is also created in the brain. So insulin and brain cells made in the brain, not only in the pancreas. High levels of insulin damage the blood vessels in the brain, and reduced insulin adds to the deterioration of brain cells. Okay. So that means that obviously, again, everything that we need to do to avoid diabetes would also be important to avoid Alzheimer's. So again, the good thing is that we don't have to think too much. We always come to the same culprits, and in terms of, sugar and part of the problem, a big problem with sugar is that I'm sure you've heard that, or you might even have said that yourself, oh, I don't eat sugar. But the problem is sugar is in so many of the foods, so you have it in soft drinks, you have it in bread, in commercial bread, that kind of quality of bread, that has sugar. You have it in all kinds of foods. And one thing I'd like to mention also is that recently, it's funny how when there is research, sometimes things happen in different parts of the world without people necessarily communicating. So that happens recently with sugar, which is two groups of scientists came with the same wording at the same time without being in contact. When one was in France at the University of Bordeaux, where scientists called sugar a neurotoxin. And at the same time, the same thing happened in the US. I think it was the University of Harvard. There was an article in the New York Times, about defining sugar as a neurotoxin. It's not that it's really new, but the wording emphasizes how more and more there is that connection seen between neurological diseases and sugar. So it's not just a little thing, it really is a poison. Yes?
Are you talking about refined sugar?
Yes.
Sugar in apples?
Yes, yes, I should make that clear. I'm talking about refined sugar. However, we need also to be very, very vigilant because the industry is so smart. you know, in terms of coming up with new words all the time. You know, Florida crystals. Oh, sounds wonderful and natural. Well, it's sugar, you know, or on and on and on and on. You know, they're all, you know, it's like as soon as they realize the public is changing on something, like suddenly now sucrose is becoming a natural sugar, you know, because people, it was years ago, people became afraid of sugar. So fructose was touted as a more healthy, because fructose, fruit, you know, it sounded good. So fructose was, quote unquote, more natural. Well, nowadays, of course, people are very worried, or are getting alerted or more savvy about, you know, high fructose corn syrup. Okay, so sucrose is becoming the good one again. You know, so we always have to kind of keep up with the changes and the wording and how things are hidden. And, you know, like erythritol and all these words, you know, supposedly good sugars, which are still same bad sugars with different names, okay? So the connection between insulin and the brain is so well recognized. Like I said, now you find lots of words like the third diabetes or diabetes of the brain, that they have come up, they're starting to have a new remedy for Alzheimer's, which is the administration of intranasal insulin. May have a therapeutic benefit for adults with Alzheimer's disease. So, of course, insulin is the remedy, the treatment for diabetes. You see also intranasal. So again, the importance of the nose, right? Again. But of course, it might be a treatment for a while, but as we all know, insulin doesn't work in the long run and it doesn't treat the problem. So trying to treat Alzheimer's with intranasal insulin will be the same. It won't take care of the problem, right? But at least what it shows us is how strong that connection is between insulin and the brain, diabetes and the brain, and also, again, the nose and the brain. So some of the words that are being used now are third diabetes, type 3 diabetes, diabetes of the brain. So common sense, of course, is avoiding sugar as a big one. And of course, that will go beyond the scope of tonight. Diabetes is not just a result of sugar intake, but for the sake of, you know, keeping things simple tonight, that's what we're going to be focusing on. But obviously, avoiding sugar and, you know, being serious about avoiding sugar, not like, well, a little bit of sugar here and there is okay. You know, we had a friend recently who went to a health food store and complained about the fact that more and more in the health food stores, when you buy food, you know, just regular food at the buffet, there's sugar in it. And sometimes they don't even list it, like it's, you know, it's not that important. And so, but he asked the question, he had bought a salad and there was some sugar or something. He said, why in the world do you put sugar in everything in your food? And the answer of the person who was there, was just an employee, said, well, you know, just a little bit. We just put a little bit of sugar. And he said, well, I don't want a little bit of diabetes or a little bit of cancer. Right? And I mean, we need to, I think, to be very, and of course we just had Halloween, you know, Halloween was that, which that's another story. You know, we get our kids hooked onto sugar so early. And of course the habit is very hard to kick. You know, it is a drug, it is an addiction, and it's so, you know, we are surrounded by pushers everywhere, you know. And so it's not a detail, and I think we really need to I know that, again, it's one of the things that I was doing that research. I've been convinced for a long time, macrobiotic studies and so on, that sugar, yes, is bad. But, when you read about that, and again, in modern research, but they don't, where I was telling you, they don't jump. It's like, well, if you're saying it's a third diabetes, wouldn't it make sense to say, avoid sugar? No, that's not there. We're looking intranasal insulin. That's the answer. That's where they go, right?
They can make money off.
That's right. But, the simple advice, the common sense advice, don't start your kids on sugar. Don't eat sugar. Avoid sugar in your food. No, they don't go there. It's too simple, right?
So the intranasal insulin is a product to sell.
That's right. And they're starting with that as a way to treat early stages of Alzheimer's in particular.
What about honey? Is honey all right?
Honey is still, that's a long discussion. Actually, what I would like to do is to refer you, because I knew some of these questions would come up and we don't really have the time to go into details, but there are many good alternative sweeteners that are complex sugars, like rice syrup. Here it's an old picture of making rice syrup. Of course, like these are steamed pears. There's amasake, which is a really wonderful, sweet product from Japan, made from sweet rice. There are lots of alternatives. I know there are lots of questions on that. What I would like to do is to refer you to an article I wrote a bit like a year ago, where I reviewed every single one of the sugars, all the sugars I could find on the market. And I think Warren also, you had one in Macrobiotic Today. Right. So the one that is on my website, and you could talk to Warren about his, the one on my website is called The Wizard of Oz: sucrose, dextrose, fructose, lactose, bad, badder, good or gooder. Oh my, I guess we are not in Kansas anymore. Because it's so complicated, the words are so complicated. So I was up to date, a few months ago, and I have not seen so much come up yet, but I really reviewed everything, including honey and including stevia and all the sweeteners. So that would be a good one to read. Okay?
So which one did you say was okay?
Well, like the complex sugars in particular, like brown rice syrup, barley malt, amasake would be good ones. Of course, the fruit, the cooked fruit, or the concentrated fruit that you can use, are good ones too.
Stevia was one that you mentioned.
Stevia, yes. Stevia, if you want to go and use stevia, make sure it's really just stevia, because again, the market is very savvy. So already you have all kinds of products that are stevia compounds with this and with that to, refine stevia to take out the taste, because it has a specific taste that, for example, I don't care for it, and many people don't care for it. So just if you want to try stevia, just make sure you find pure stevia. Stevia can be helpful, especially for people who suffer from candida and who cannot use the fermented syrups. Okay? And you can grow the stevia plants in a pot at home and use the leaves, yes. All right?
Would you consider alcohol consumption something to avoid along the lines of sugar?
Absolutely. I'm going to talk about that in a moment, actually. All right? So let's look now, yin deficiency. Remember, one of the things that we want to do for Alzheimer's is to keep the yin, the moisture. And of course, as we grow old, naturally, there is a tendency to get more dry. That's why we get more wrinkles. That's, there's a drying of tissues that happens with old age. So that means as we grow old, we want especially even more take care of the good quality yin in our body. So the image of the kidneys would be we need good fluids, which would be the kidney essence that we talked about at the beginning, and then the fire, a good kidney yang at the same time, good adrenal, good, in order to be able to cook the liquid and kind of send the steam out, a bit like the clouds in nature, right? Like the ocean. So if we consider the kidneys the ocean, we need this kind of warmth to enable the formation of clouds, and then that kind of nice mist that hydrates our tissues and organs, right? So if you want to take care of our yin and the yin of the brain, that needs that moisture, we saw how it gets calcified and dehydrated. Obviously, common sense, we want to avoid burnout and dehydration. And so the things that tend to accentuate dehydration are coffee, diuretics, anything that are, too overly diuretic, cigarettes. They are, they especially bad for the yin of the lung, and we saw, So there's been some figures that show that people who smoke have more of a risk of Alzheimer's, which makes sense. Lung again, the qi, what we saw before. And then alcohol. Now alcohol, we need to have maybe stop here a little while, because of course it's a form of sugar. There are many studies, and sometimes it can be difficult. You can find studies for everything, kind of, and saying different things too. But about alcohol, it seems like in most studies, what they're saying, it seems like moderate intake of alcohol is actually helpful for Alzheimer's. And which I think can make sense, especially like, let's say, for example, in France, if people are going to eat meat or dairy, it's certainly better to drink a glass of wine with that than it is to drink a glass of Coke, right? The sugar is the worst to drink with that, which is why Americans have such a high rate of heart disease. It's not, it's the meat, it's the food, but also the combinations, like drinking coffee and sugar during the meal. So certainly it would make sense. In Chinese medicine, we use wine a lot as a blood mover. Like let's say for remedies for arthritis, for example, we're going to use a little bit of wine for the herbs. Very mild, it's a rice wine, to warm up. It's just like if somebody is very cold and comes back, and they're freezing and they're shaking, and you want to get them, or if they're unconscious, if you want to revive them, you're not going to give them a big piece of salt, right, to revive them. You're going to give a little shot of alcohol. So the alcohol has that blood-moving quality. So for the stasis, for any kind of stasis that happens in the body or in the lung or in the brain, wine can be helpful. Of course, depends on how much is okay and how much is not. Because on the other hand, high consumption of alcohol, and when they define, what I found, when they define high consumption of alcohol is that more than, as much or more than one bottle of wine at any one time is high intake. Then there's a higher risk of Alzheimer's. Lots of people do it. Of course, nobody here. So, and also I think a lot depends, on the food combinations, right? So let's say that very moderate intake of wine seems to be okay because it's fermented, it has that fermentation aspect and that blood-moving quality. It also depends, again, on everybody's condition. Like someone with candida cannot tolerate any wine. You know, so, and also people, you have people who have hypertension or heart problems, and even if they drink, my mother is one of them. Even if she drinks that much, she gets palpitations. She cannot tolerate any wine at all. So, you know, a lot has to do with personal conditions, personal tolerance, habits, and, you know, knowing what you can do and what you cannot. But certainly small amount seems to be good for Alzheimer's, but big amount very detrimental for Alzheimer's. Yeah, you know, I cannot say that here too. I would say, you know, I'm sure that it would be the same would apply, meaning it depends on the level. I mean, I lived in Japan and I saw people who were, you know, highly alcoholic and lost their mind on sake. So I don't think it's any safer. It's all a question of quantity, quality also. Quality is another thing that makes a huge difference. You know, the way it's made, a bit like miso or anything. You know, a very good wine is not acidic. A very good sake is not acidic. A poor quality sake is very acidic. So all of that plays a part also. Okay. So the things that are good for the yin are the rest, good sleep, meditation, what I call yin activities, you know, making sure that we get the tempo down and are able to rest. That's, you know, sleep, good sleep. That's a time when naturally we replenish the yin of our body and the body fluids. Okay. Music. Here is something interesting too in music. What has been found too is that even with people who have already fairly advanced in Alzheimer's, do better with recall with music. Meaning that if you want to help people remember, you create little rhymes and little music. And that people with Alzheimer's already can remember better if things are put in music. The theory is that, you know, all of the brain is involved with music, but that's a way to enhance recall, is to put things in music. And so I know that in Chinese medicine students learn all the formulas, the Chinese medicine formulas, in rhymes and music. You know, the Chinese language is very melodious and has tones, so it's very sing-songy already. And that's really a way that kids learn a lot, is by singing, sing-songing you know, what they learn. So that's a good little trick to know, you know, to help memory, to work on memory, and also to help people who already suffer from Alzheimer's and to help the recall. Because sometimes just helping a little bit on the recall can assuage some of the anxiety that comes from not remembering, right? So the foods that nourish yin, we always have to come to the foods. And of course, again, the good thing is never too difficult. We always come down to the same good ones. Vegetable quality, root and leafy vegetables. Seeds are very nice. Also, seeds correspond to kidney energy. They're rich. You extract the oil, you know, from seeds also. So sesame seeds, sunflower seeds, all of those are really good, and they're full of nutrients. Cooked nuts, or soaked nuts, beans, yes?
Raw seeds or cooked seeds?
Both actually. But actually, seeds best is to also to soak them, or to, you know, to roast them and to grind them. So, beans are also good. Beans in Chinese medicine are considered tonic for the kidneys. Okay. Soups are obviously an excellent way to cook, to nourish the yin. The liquid is helpful, right? So soups is a great way. It's the closest to a medicinal decoction that we can have. So soups are a great, as we grow older, certainly soups are a wonderful tool to replenish the yin. Vegetable soups, obviously bean soups, you get double advantages, you know, for the health of the kidneys. Morning porridge, you know, in breakfast, it would be ideal to replenish the yin. We tend to get dehydrated at night. So, you know, the toasts and the dry foods in the morning are not the best. because we are dehydrated, so we should have some kind of moist foods. So morning porridge, a little bit of grain or vegetables cooked together in a water, with water are the best. Grits with porridge would be fine. Moist foods, basically, and good quality vegetable oil would be. What is also very good for the yin is sea vegetables, right? They are the trees of the ocean. And so they're very good to nourish the kidneys. Of course, sea vegetables are a little bit salty, so you don't want to overdo, take too much of it, but a little bit every day is a great way to nourish the yin of our kidneys. To nourish our ocean. And basically sea vegetables, as we know, with the scare of Chernobyl or Fukushima, how everybody, suddenly everyone bought all the sea vegetables they could find, right? Because we know, it's very well known now, that is one of the best things to detoxify the body. So, they do in our blood what they do in the ocean. They cleanse our blood. So they're a great tool. So, and here too, it goes beyond the scope of tonight, but if you don't know about sea vegetables and want to know how to use them, we have many programs here, many classes, and many people, including Michael, and Lino is not here tonight, but Maggie, who is here too. Many people who can help you, and there are many cooking classes. Joanna gives cooking classes regularly, and she did some on making sushi. It's great, to know. So there are really lots of resources. And with our AMA association, we constantly try to give programs on that, on how to cook with sea vegetables, making sushi, so it's, you have many resources. Well, Marquita and Warren also give cooking classes. So many resources here in Asheville that you can take advantage of. So on the positive side, the things that are seen to help with Alzheimer's is to have a goal in life, to keep the enthusiasm given. Remember the neuroplasticity? So I remember the case of one lady in France who died when she was 116. And she was very famous at the end of her life, of course. And she got so famous, I think that it might have been what killed her. Because they had her do a CD and on TV shows, and she was singing, and she was so famous suddenly. And so she passed away at 116. And people would always ask her, what are your secrets of longevity? So, no, Edith Piaf, no. Edith Piaf died very early and from drug addiction, unfortunately. So no, her name was Jeanne Calment. And she was not a famous woman, until she became over 110. And interestingly enough, she had picked up fencing. She had started fencing when she was 80 years old, right? She had been biking until she was over 100. And listen to that, she quit smoking when she was 110. Now, and she also said that she had, every day she would have a little glass of port. So, very interesting. However, the other side of the story, she said she quit smoking because she hated being dependent, and she could not see so well anymore. She didn't want to be dependent on anybody to light her cigarettes. But, all right, what we should know, what we need to know, because I was very intrigued, but at the time I smoked, and I thought, wow, who cares, right? There's hope. So I was very interested in her story. But first of all, the time that she lived, you know how they use that dark tobacco in France, very dark. So at the time there was no chemical, no additives. And if you smoked a cigarette and you did not light it all the time, it would just it would go out, right? The paper also. When today it smokes by itself, right? So she used this old, and she would roll around cigarettes, and she smoked 1 cigarette a day. So I was like, oh, okay, not quite the same. And same thing with the port, it was a little, it was not even a glass, it was a little shot of port. So there you go. But certainly she was a very active woman and, full of zest. And, when they told her, come on TV shows and come sing, and she was ready. She did a city. So being mentally active, I'm sure all of you have heard about that. Remember the neuroplasticity, so learning a language at any time, learning a new skill, all of these are very helpful. And I'm sure many of you have the experience with Alzheimer's. Part of the problem is also the social view we have of Alzheimer's, not only the expectation, but how people suddenly become isolated, and also in environments that don't give them the right food necessarily. Also, that's another problem. And also we tend, to maybe baby people too much when actually they need to be given some responsibility or to be stimulated in some ways, which I know is not always easy, so that's another discussion. But basically anything that can keep us mentally active and not going with the idea that, I'm old, therefore, it's too late for me. Well, no, it's never too late. From the brain point of view, it's never too late. Loving environments, socially involved, good friendships, spiritual practice. I mean, all the things that give, enthusiasm and value to life are important. Exercise is very important. So here too, there have been several studies, and that showed that after 3 months of regular exercise, the volume of the brain would increase again. It's that important because, of course, Alzheimer's has a lot to do with lack of oxygenation and therefore stagnation in the brain. So getting things moving with goals, moving with enthusiasm, moving with practice, the foods that move in us, not the ones that clog our intestine. Movement is really the key. So here I thought these were few inspiring pictures. Look at this lady. Right? Look at this one. So you see, anything is possible at any time. And even if we cannot quite get to that, we can certainly make sure that we move. Walking has been definitely confirmed as one of the best possible exercises. On the positive side, self-care and prevention are very important. So I was telling you before how massage, facial massage, and self-massage are important. So let me just show you a couple of things here. See this picture here? Right? It's called beating the heavenly drum. The Chinese always have those beautiful names, where you put your thumbs here in the back of the neck, in the kind of holes, and then you kind of beat. That's beating the heavenly drum. And doing it, like especially also this area, remember the hippocampus? So this is a very simple movement, but it's part of all Qigong practices. And just doing that regularly to get, again, things moving is a good, simple exercise. Also doing facial massage, the eyebrows, the temples, massaging the nose, and the sinus area in particular, again, getting things moving. The bottom of the nose here where we have the large intestine meridian that ends. So doing that kind of massage. And for those of you who practice Qigong, and maybe in some yoga, I don't know, but we always end, or I know with the teachers I work, we would always end with some kind of, massage at the end. So typically we do this. We start there, heavily drum, doing the head, and then, doing some massage on the temple, massaging the nose, all those points. Remember, stomach points, large intestine points, and massage the neck. Right? As much as you want. Anytime you have a moment to do that. And when we feel tired, just doing that can be very energizing. Same thing actually, for all the movements on the body, but basically getting things moving and working on the head. So in acupuncture for Alzheimer's, an important part is scalp acupuncture. It's not the only one, there are other points too, but doing scalp acupuncture. And even though it looks very maybe scary or impressive, the skull is actually very safe. There's the bone, so you cannot, go into the brain. So scalp acupuncture is very much used for neurological problems like Parkinson's or MS, and for Alzheimer's too. So certainly getting regular acupuncture, if that's part of what you do, it's a great thing also to do to help for prevention and for brain functions. Yeah?
How much have they seen results with acupuncture for current Alzheimer's patients?
I could not really answer that in terms of advanced cases, and that's where at the beginning I said, there might be question on that. I think part of the problem, the way I see it, is that, first of all, in Alzheimer's, beyond a certain point, it's very hard to reverse because the care is very difficult. Like, the kind of energy that it takes to take care of somebody who cannot take care of himself or herself anymore is very difficult. So I think there's a point when people lose all ways of taking care of themselves. The best that we can do is help them be comfortable, make sure they don't get too agitated, because that can be prevented. However, early types of Alzheimer's, that is found to be reversible already. Okay, so I think though that it's not just one thing, it's like the food is important, the exercise is important, the environment, the kind of care, so acupuncture, yoga, exercise, qigong, all of that plays a part. So in China, certainly old people have a great advantage over here. They're much more part of the community. You often have hospitals where you have Western medicine on the first floor and Chinese medicine on the second. It still is very much like that. When people have a heart attack, for example, and they are very quickly rushed to a Chinese medicine hospital where they get acupuncture for rehabilitation. So there is a better care. However, that we can certainly include many of those things, or try as much as possible to include them here too.
Do we have anything like that kind of hospital in the United States?
No.
Absolutely nothing?
No, not yet. Hopefully that can come. That would be, would be good, where there can be that kind of care. Yeah.
For the agitation, I'm used to Western medicine with Haldol and Ativan and all that garbage. I realize music might work, but what, in addition to music, might work to calm the agitation?
Okay, so there can be some herbs, and here too, it's a bit beyond the scope, but if you could talk to, to some people who can maybe guide the particular question here, like, Michael is also can help with acupuncture and things like that, and I do too, and with herbs. For example, one of the things that often contributes to agitation of people with Alzheimer's at night are undetected infections. that contribute to that heat. So bladder infections. So a good thing to do would be to give simple herbs to take care of any possible undetected infection that people might not impress. But because there's a lot of yin deficiency, there are often stuff like urinary tract infections, and which is recognized in Western medicine as one of the causes often of the agitation. So giving herbs and environments that are calming, and there are lots of Chinese medicine herbs that are very helpful for lots of ailments. And the psychotic drugs that are given in Western medicine, the problem is they're so strong. They're so strong and they cause death most of the time. And that's also recognized. So getting the qi moving. And, oops. Let's see, why is it not? Sorry, I'm having a trouble here. Okay, I already went there. So I already talked about scalp acupuncture. Herbal medicine, we just talked about that too. So, there's really quite a lot that can be done. And people react very well, for many infections with simple herbal treatments and food. Before we go to anything too strong. And so I want just to finish with that image that Alzheimer's, I think, you're asking about Chinese medicine hospitals in the West. What it shows is kind of a collective amnesia. It's kind of an archetype, I think. Like if you've read books by Caroline Myss, she talked about how certain diseases, certain epidemics correspond to certain social problems at certain times. And I cannot help but think that, Alzheimer's is such a devastating epidemic right now that it's our problem. It concerns all of us, certainly. And it shows how we have forgotten so much about how to take care of ourselves, how we dismiss so much the signs, and we want to keep on doing what we do, no matter what the cost, no matter what the cost to our oceans, no matter what the cost to we just want to keep, our habits. And so we forget, collectively, we have forgotten very much about simple things to take care of ourselves, to take care of other people. And to respect ourselves. Right. And one characteristic which makes it sometimes difficult with Alzheimer's but concerns all of us, you see how one of the symptoms is calcification, right? Rigidity. So it's that rigidity of thinking, is the refusal to change. And sometimes that might be quite a challenge for ourselves, and also helping somebody with Alzheimer's. There can be a rigidity of not wanting to do things differently. We need to continue that flexibility of our bodies, but also our minds, and to listen to the messages of our bodies. So I will stop there. Like I said at the beginning, what I wanted to do is really show that it's not really a mysterious disease. When we understand how it happens, it's like all the other diseases that plague our world. So whether we're talking about heart problems, whether we're talking about strokes, whether we're talking about calcification of the brain or arteries, it's always the same process. And we have many tools at our disposal to help ourselves with that disease. Okay, so I hope I give you some hope.